For shoulder injections, the animal is placed in lateral recumbency with the humerus in a neutral position. The landmark is the spine of the scapula. Note, canines have an acromion process at the tip of the spine, but felines do not. Place several fingertips along the spine and walk them until your index finger falls off the end. For a 40-pound dog, the injection site is typically 1 finger's width from the end of the acromion process. Ideally, the exact distance should be measured on a digital radiograph. If you miss the joint, you will need to walk the needle towards, then away from, the spine. It is important for the needle to stay in the same 2-dimensional plane as the spine of the scapula. To help open the joint space, you can place a towel underneath the shoulder. Gravity will do the rest. To recap, walk off the end of the acromion process a predetermined distance. Insert the needle perpendicular to the skin. Advance the needle in one smooth continuous motion until you pop into the joint or hit bone. If you hit bone, walk the needle towards, then away from the spine.